pass you that. Oh, Jesus. Have this. Next time, you have that. Welcome to the regular meeting of the Public Health and Safety Committee for April 17th, 2024. My name is Jason Chavez, and I'm the chair of this committee. I also want to note for the public record that Councilmember Rainville and Councilmember Ellison reached out ahead of time and have let me know that they will not be in committee today. At this time, I will ask the clerk to call the roll so we can verify the presence of a quorum.
Councilmember Payne.
Present.
Rainville is absent. Ellison is absent. Palmisano.
Present.
Vice Chair Wansley.
Present.
Chair Chavez.
Present.
There are 4 members present.
Let the record reflect that we have a quorum. With that, the agenda for today's meeting is before us. There are 5 items on today's consent agenda. Item number 1 is the passage of a resolution approving sponsorship of National Night Out in Minneapolis. I want to thank our crime prevention specialists and city staff for helping with this item, which will waive the application fee for all required city-issued residential block event permits for National Night Out. This will help ensure these important events will continue to be free for our residents. Item number 2 is authorizing a joint powers agreement with the Minneapolis Police Department and the state of Minnesota for MPD's Mounted Patrol Unit to assist with the Minnesota State Fairgrounds. Item number 3 is authorizing a joint powers agreement with the City of St. Paul to allow for the transfer of investigations of civil rights cases. Item number 4 is authorizing an increase to the contract with CITUL for Labor Standards Collaborative Enforcement Services. Item number 5 is authorizing a grant from the Mississippi Watershed Management Organization to hire interns. Additionally, item number 8 will need to be delayed a cycle to the next PHS meeting, which is on May 1st, due to unavoidable circumstances, but they will present at the next PHS meeting. Is there any discussion on these items? Vice Chair Wansley.
Thank you, Chair Chavez. I'm going to move item 2 for a separate discussion.
Item number 2 will be moved for a separate discussion. Seeing no further discussion, I will move approval of the consent agenda, which does not include item number 2, and a delay for discussion item 8 for May 1st. All those in favor say aye.
Aye.
Those opposed say nay. That carries and the consent agenda is approved. Next, we have item number 2, and I will call on Councilmember Wansley.
Thank you, Chair Chavez. I just want to make the motion to forward this to committee without recommendation.
Councilmember Wansley has moved to move without recommendation item number 2 to full council.
Does that need a second?
Yeah. All those in favor say aye.
Aye.
Those say nay. That item carries, and that item has been moved to full council for recommendation of no, with a recommendation of no recommendation. Discussion item number 6. The next item is a presentation on the U.S. Department of Agricultural Forest Services Urban and Community Forestry Grant. Here to present on this item is Sydney from the Health Department. And I assume we have other staff too, but Sydney, when you have time, we are here for you.
Thank you. All right. Hi, everyone. My name is Sydney Schaff. I am the City Trees Program Coordinator in the Health Department. I manage the City Trees Program, which is a private property tree planting program. And today I'm here to share information about the Minneapolis Equitable Tree Canopy Management Program. So we pursued this funding due to advocacy from community members and groups. So I just wanted to start off by acknowledging and thanking some of those people, including Roxanne O'Brien, Mitchell Hansen, Metro Blooms, and the Minnesota DNR. So the Health Department, in partnership with the Minneapolis Park and Recreation Board, were awarded $8 million. This is coming from the Inflation Reduction Act Urban and Community Forestry Grant from the Forest Service. So this presentation will share the main areas of work through this funding, as well as who is eligible to receive it. So property owners citywide that meet our established criteria will be eligible to have their tree and stump removed, as well as a replacement tree planted in their yard free of charge. To be eligible for this program, residents must be at or below 80% AMI, be enrolled in a social service program, or provide subsidized housing in a CJUST census tract. And CJUST stands for Climate and Economic Justice Screening Tool. It is a White House tool that was developed to identify disadvantaged areas, and the Minneapolis Green Zones do entirely overlap with those CJUST areas. So the bulk of the work will be for private property. So the majority of the budget is going towards private property tree removals, stump removals, and tree plantings for eligible residents. We do want to note that the Forest Service has stated that these funds cannot be used retroactively. They can only cover removals or any work that occurs once the grant funding is in place. Additionally, the Health Department will be hiring 2 new staff members. We will have a tree outreach coordinator that will serve as a liaison between community organizations, program participants, and city staff. And we're also going to be hiring a community forester that will be an ISA certified arborist to provide in-house technical expertise to the Health Department. We also have funding for the Health Department's Green Career Exploration Program. They are going to provide training and certification in sustainable land care, as well as training and workshops in community forestry basics. Finally, we have just over $500,000 dedicated to community partnerships. We'll be issuing an RFP to identify community organizations to perform outreach and engagement on emerald ash borer, tree maintenance, treating trees for pests, the tree removal process, and best practices for tree planting and pruning. And all of the outreach and engagement will be emphasized in the green zones and/or target communities of color. So that concludes my presentation today. My contact information is here if you all have any questions in the future. Otherwise, I'm happy to respond to any questions the committee may have now.
Thank you so much, Sydney. I'll pass it on to Vice Chair Wansley.
Thank you, Chair Chavez. Thank you so much, Sydney, for this presentation. I was really excited to see this come on our agenda for today in light of what you offered some context at the beginning of just knowing the history of advocacy that community leaders like Roxanne O'Brien, who was even honored this morning as a public health hero, and even Councilmember Ellison highlighted that too as he was honoring and recognizing her leadership of, it's been her advocacy around emerald ash boards and the disparities or the impacts of inequities and how that has really, subjected Black households, especially in North Minneapolis, to a variety of financial crises. And I'm grateful for community leaders like her and so many others that continue to, press the city to identify resources like this, to go after grants, to support them, at least proactively. I would absolutely love to have conversations with my colleagues and city staff about what we can do around that retroactive piece, because we know, again, a lot of predominantly Black households, especially in North Minneapolis, also in South Minneapolis in our green zones, they had to provide, dollars that they likely didn't have to be able to remove these trees. So we need to be cognizant of how we can also leverage resources here at the city to support those who have done this work and were put in a very precarious position financially. But really excited that we do have resources to offer households moving forward, and really wanted to take the time to make sure that residents across the city knew, we have this resource, how to, contact staff about eligibility to receive resources from this. I'm so really thankful that you came forward today and did a presentation on this.
Absolutely. Thank you, Councilmember Wansley.
Thank you. And Sydney, I do have one question. If you can help clarify the budget component, it's $8 million. Part of that is for the tree removals, and I think does the personnel, green career exploration, and the community partnership, is that part of the budget too?
Yes.
Okay. Thank you. I don't see anybody else on cue, but thank you so much for coming today and walking us through this important program. Seeing no further questions, I will move approval of this item. All those in favor say aye.
Aye.
Those opposed say nay. That carries, and that item is forwarded to next week's council meeting. The next item is receiving and filing a presentation of the 340B drug pricing program. Here to present on this item is Jeremy from Abbott Northwestern Hospital and Allison Pence from Malina Health. Welcome.
All right, good afternoon. Thank you, Committee Chair and Council members. My name is Jeremy Inger. I'm the 340B Program Manager for Allina Health, and I'm here today with Allison Pence, the Director of Community Engagement for Allina Health. We're here today to provide our annual presentation in relation to the Memorandum of Understanding that Allina's Abbott Northwestern Hospital signed with the City of Minneapolis on July 1st, 2020, as required by HRSA, which is the agency that oversees the operation of the 340B drug pricing program. This Memorandum of Understanding is a part of the 340B drug pricing program eligibility criteria for participating covered entities, and it helps ensure that Abbott Northwestern continues to have access to this vital drug pricing program that aids in the work being done with the indigent, uninsured, and underinsured in the community. I'd like to start by providing a brief overview of Abbott Northwestern Hospital, located at 800 East 28th Street in Minneapolis. And then I'll follow with a quick overview of the 340B drug pricing program and how the Memorandum of Understanding plays an important role in maintaining eligibility for the program. And then finally, I'll turn it over to Allison for an overview of Abbott Northwestern's community engagement. So as you can see on the first slide, Abbott Northwestern serves over 200,000 patients and their families annually. And I do have a payer mix listed for 2023. 67% is public and 33% is private for Abbott. And of note, I did want to call out that the public payer mix did increase. So in 2022, that public mix was 51%. And it has gone up to 67% in 2023. So this continues to demonstrate the need in the community and the importance of this program. So what is the 340B drug pricing program? So it is a federal government program administered by the Health Resources and Services Administration, or HRSA. It entitles certain entities to access discounted prices for their outpatient drugs. And Abbott Northwestern qualifies due to caring for a high number of low-income patients. The savings allow Abbott Northwestern to provide expanded services in the community. HRSA does require a memorandum of understanding between the hospital and the local government. And the MOU is Abbott Northwestern's commitment to continue providing free and reduced cost healthcare services to those indigent, uninsured, and underinsured residents of Minneapolis and the surrounding communities. And I did want to point out again that this is a federal program, so there's no direct financial relationship with the City of Minneapolis. All right. And on this page, it talks a little bit of the community benefit. So you can see the number of applications for free or reduced services, a little over 41,000 for Abbott. We have charity care, and charity care is essentially free care for those that are unable to pay for their health care services. We've got an uninsured discount, and that's a cost reduction for those without insurance, but that do have the ability to pay. And then finally, Allina does offer a free drug program as well. And now I'll turn it over to Allison to discuss Abbott Northwestern's community involvement. Thank you.
Hello, I'm Allison Pence. I'm the Director of Community Engagement at Allina Health. And as part of our commitment to community, we are here today to talk a little bit about how we are serving the city of Minneapolis. We really focus on how we are serving the people and where we are physically in the neighborhood. From the serving the people perspective, one of our programs right now that is really robust is our Early Youth Eye Care program. We screen about 12,000 students in the Minneapolis public schools every year. These are children who normally would not have a vision screening every year. Our staff come in, screen them, and if they screen for needing follow-up care, we also connect them to services. Sometimes we provide the services ourselves through our program, ensuring that kids who are going to school in the Minneapolis public schools have the ability to see, which we appreciate is so important to their overall school success. We have also joined the White House commitment to end hunger. We're really looking at food access as a strategy for how we are ensuring the health of the people we are serving. We know from screening our patients in our health-related social needs program that food access is one of the top priorities for patients. Housing and food access are the top priorities in the city of Minneapolis specifically. So we are really working on building relationships with key community partners to ensure that people living in the city of Minneapolis have access to food in a variety of locations. And then we also continue work on community safety coalitions, really working with community partners, working with the city, working with other government agencies, really addressing some of the hot spots in our community, and we've actually been very successful, I would say, within the last year. Really have seen a nice downturn in some of the hot spots that we've historically seen. And then just the number at the bottom is over the last 20 years or so, almost, we have donated more than $27 million worth of goods, services, support, supplies to City of Minneapolis organizations, schools, and various community partners. In terms of where we are located in the heart of the Phillips neighborhood with our Alina Commons headquarters right next to Abbott Northwestern, our largest hospital in our system, we've put a lot of money and effort into investing in sustainability as part of our commitment to the community. With our new purple ramp parking structure, which we created to make room in the middle of our campus for a construction project that's going on right now, we incorporated a lot of sustainability into the parking ramp structure itself. We put in a 5,000 square foot pollinator garden along the greenway. We put that in 2 years ago. We are continuing to maintain that to ensure that that is continuing to serve the neighborhood. We also added 20 electrical vehicle charging stations inside our new parking structure, so those are open to employees, visitors, patients, anyone who needs access to an EV charging station has access to that in that ramp. And we are also in the process we are about to kick off the construction of a solar roof on that parking structure, which Cooperative Energy Futures, which is a South Minneapolis-owned business, is our contractor. They will be installing a solar roof on that structure this summer, and ultimately by the end of the year, we expect that that roof will be generating about 1 megawatt of electricity every year, which we intend to turn around as offer subscriptions to that for residents living around the campus, so that people who live around Abbott Northwestern will have access to reductions in their energy bills because of the energy being generated by that parking structure roof. We also opened a new utility plant on the north end of our campus a couple of weeks ago. It's been under construction for the last 2 years. It is now open. The purpose of that plant was to replace 1950s era equipment. So we had really old boilers and generators running the hospital for the last 50 plus years. So this new energy facility has much more modern, updated, energy efficient, clean technology. We replaced 9 emergency generators with 3 state-of-the-art generators, which allows us to provide the backup generation we would need if we ever needed to at a much cleaner rate. And then when we really look at investing in our community, we're also looking beyond our own doors. We have created an impact investment fund within Alina Health. We set aside 1% of our overall investment fund for the whole organization with the intent that $30 million will be given as investments to community organizations. Specifically, we put a lot of investments into CDFIs, local housing developers, various organizations that you can see listed here. The building list that you can see in the picture is Midwell Apartments. It's brand new right on the Greenway, very close to the Alina Commons. This was partially funded with an impact investment from Alina Health that allowed this developer to turn this property from market rate into affordable housing, and 11 of the units in this property are set aside specifically for families transitioning out of homelessness who have supportive services provided by Simpson Housing as partnered with the developer. And we also have a construction workforce diversity program. We are building a significant building in the middle of the Abbott Northwestern campus right now, part of our newest hospital building. And we have a partnership with Mortensen Construction, and they have a community workforce program underway, and we are really going to be kind of kicking that into high gear over the next 6 months as that building really starts to come out of the ground and the need for more subcontractors comes online. And their community workforce program essentially is open to anyone in the community who has an interest in working in construction. They can literally have a walk-on role within this project, partnering with Mortensen. So we have a website for that, and they are going to be really, like I said, kind of kicking this up into high gear in the next couple of months. I'd be happy to share links for ways that you could share with your constituents if you have people who are interested in a workforce training program in construction. we'd love to have you send them to this program because, like I said, we need a lot of people to help build this. And when the Allina Health Board set aside money for Abbott's construction project, one of the pieces they told Abbott leadership was, these dollars cannot just benefit Allina, they must also benefit the community we serve. So that is why one of the reasons we selected Mortensen as our partner, because of this type of project that they have. And that is the end.
Cool. Thank you, Jeremy and Allison. It's always good to see
Absolutely.
you.
It's good to see you too.
I'll pass it first to Councilmember Palmisano.
As you were talking, I just had a couple of curiosities. The first was you talked about the public versus private payer environment, and I'm curious, I know you serve predominantly a low-income community, but can you give us a sense of how many are Medicare patients within that public figure?
Yeah, I don't have the breakdown with me, but I can certainly follow back up with those numbers, yeah.
That's not necessary. Can you give us a sense, though, from Abbott Northwestern? Because I think the last time I was there was probably 20 years ago for visiting a friend in intensive care. But can you give us a sense of the age of population that you serve? Is it predominantly, you do a lot of work with children.
Absolutely.
You do a lot of rehab work, like physical therapy kinds of rehab. Can you just give us a sense of your patient mix, maybe from an age perspective?
Yeah, it really spans all patients, all the way from, mother baby to, caring for the elderly. So can really, I don't have an exact breakdown, I guess, numbers-wise, but
just a curiosity. The other was, I was curious in regards to your energy use improvements. Have you considered, or did you work with the city through our green cost share program at all? Or is that something maybe for improvements in the future?
Yeah, I don't believe we did work with the city, but we certainly can have that conversation in the future. We are continuing to conduct construction in the neighborhoods. So that didn't come up, I don't believe, earlier. So
sure.
I'd be happy to
curious what partnership opportunities there might be through our green cost share program. This is a particularly impacted area environmentally, and that would be good to put together. Thank you.
Thank you, Councilmember Palmisano. I'll pass it on to Council President Payne.
Thank you, Chair Chavez. I was curious about the eligibility for the 340B program. Would that be at the hospital level, the system level, or the patient level? Like, does a patient need to qualify for those pricing discounts?
Nope, the patient doesn't qualify. It's all at the hospital level. So there's different criteria, and for us, ours qualified based on what's called disproportionate share, based on a Medicare cost report filing. But yeah, it's all done at the hospital level.
So then, whether you're showing up as a Medicare or Medicaid patient, or you have a Cadillac private insurance, the reimbursement rate's going to be set at the 340B price rather than, or would it navigate down some way for that?
Yeah, so the 340B pricing would actually be related to the purchase of the drugs.
Yeah.
So it's all really based on, eligible departments within those hospitals, and if those patients are seen there, we're dispensing medications out of our inventory, and it gives us the opportunity to repurchase at the 340B drug costs.
So then for those savings, are those funds restricted, or do they go into like a general operating fund for the hospital just normally? Right.
So yeah, the savings, there's no stipulation to the use of the savings per se, other than reinvestment back into expanding care, services for the community. So it goes back into a general fund, and then those decisions are made afterwards.
So our MOU doesn't dictate the terms to which you can use those dollars. That could go anything from expanding your campus to hiring more staff to anything that the hospital would see fit.
Correct. Yep. So there's no stipulation in the MOU as far as how those funds are used, but obviously, as Allison had mentioned, Allina and Abbott tend to try to be really good stewards in the community. So we make sure that as we're looking at the savings that that we're seeing, that we're turning around investing. And I mentioned the free drug program. So that's one area that we've recently expanded. So you'd mentioned, expanding staff. So we've been able to expand staff. Thereby, we're able to offer more services to those patients in relation to the free drug program.
Does the federal government put any stipulations on in terms of that?
They do not. Correct.
Okay. Is there an opportunity through our MOU process to maybe do some strategic planning where we develop some shared priorities on how those savings could be used?
Yeah, we can certainly take that back for sure.
Thank you.
Yep.
Thank you, Council President. Vice Chair Wansley.
Thank you, Chair Chavez. In the spirit of request for continued collaboration, I was really interested to see the slide referencing the work you all are doing to expand access to food and combat, it sounds like, food insecurity. And I know this council has adopted, I believe, the food vision policy in collaboration with our homegrown council, because we recognize food insecurity is also in connection with a number of other issues like environmental justice or injustice, so our green zones, and just knowing that it would be great to figure out other ways to collaborate with other key stakeholders like you all in thinking through, existing work that's being led by community members and how we can, identify additional, solutions or action steps. But just wanted to say that's something I would love this body to follow up on in collaboration with you all.
Fantastic. I would welcome that collaboration as well.
And we can reach out after, and we can connect emails with Allison too. So,
Fantastic.
thank you, Vice Chair Wansley. I don't see anybody else on queue. So seeing none, I will direct the clerk to receive and file that report. Thank you both so much for being here in committee today.
Thank you.
The next item is receiving and filing a presentation on commercial tobacco prevention initiatives. Here to present on this item is Evelyn from the Health Department.
Thank you, Chair Chavez and council members. Good afternoon. My name is Evelyn Carberry, and I work on the Healthy Living Initiative team at the Minneapolis Health Department. So first, I'm going to be speaking about our work specific to commercial tobacco prevention over the last several years in this city. But first, just want to give a brief overview of the Healthy Living team. So our team focuses on chronic disease prevention, and we do this through a number of ways, including making nutritious foods and beverages more accessible, increasing opportunities to be physically active during the day, reducing exposure to commercial tobacco products, and improving community well-being so everyone in Minneapolis can live longer, healthier lives. Our work is really embedded in a few goals. First and foremost, our partnerships. So we work really closely with community partners, so be that community-based organizations or individuals. A strong focus on equity and really focusing on the communities most impacted by health inequities. And lastly, creating policies, practices, systems, and changing the broader environment to create positive health outcomes. And I would just like to note, we specifically call out commercial tobacco when we do this work, knowing that we want to clearly distinguish between commercial tobacco and sacred tobacco. So our work in commercial tobacco really focuses on two main areas. So the first is increasing access to affordable smoke-free housing, and the second is tobacco policy work. So a lot of that is focused at the point of sale. And when we say smoke-free housing, we are focusing on indoor air. So we're not telling people not to smoke, just that if they choose to smoke, to do so outside to avoid exposing neighbors and loved ones to secondhand smoke. So first I'm going to talk a little bit about our smoke-free housing work. So as more scientific data becomes available about the dangers of second and third-hand smoke exposure, especially in multi-unit housing, the need for strong smoke-free housing protections has become more clear, and this is something that residents are asking for. So here you'll see some statistics on the screen. So in 2009, a survey found that 3 out of 4 every Minnesota renters preferred smoke-free housing. In 2016, the health department did a survey of property license owners, and we found large disparities between buildings that have subsidized units and those that are market rate, with only 45% of buildings with subsidized units having a smoke-free policy compared to 71% of market rate buildings. In 2018, almost 92% of all adult Minnesotans report having voluntary smoke-free policies. So that's just where they self-report, I don't let people smoke inside my home. And then in 2018, a survey of non-smokers who live in multi-unit housing found that almost 15% had smelled smoke in their homes within the last week. So what do we do about this? So just some recent accomplishments. So in 2018, we conducted a large Thank You for Taking It Outside campaign, and we've continued this messaging over the last several years. So we really try to work from an area of appreciation and just focusing on the importance of neighbors and community members, and saying that everyone deserves a smoke-free home. In this past January, we worked closely with our rental licensing colleagues to provide information about the free support that the health department offers to property owners and managers who want to implement smoke-free policies through outreach to 25,000 rental licensing applicants, as well as we continue to work very closely, especially with our public housing colleagues, on equitable enforcement of their smoke-free policy and just reminding residents of the requirement to have a smoke-free building for public housing. Over the last few years, we've been doing some community engagement, considering possible future smoke-free policy work, and just some examples of what this policy work might look like. So one idea would be to create an incentive. So that could be something as a promotion or a discounted fee for property owners who have a smoke-free policy. Another potential policy option would be disclosure, which Minneapolis does not currently have. So a disclosure policy would require property owners to disclose to future renters or homeowners whether or not the building has a smoke-free policy. And a third potential policy option would be a requirement, so making it a requirement to have a smoke-free policy in any multi-unit housing. And we've been doing a series of work, so we did a survey with Section 8 housing, housing choice voucher, and project-based voucher participants. And through that, we found that most did support policies around smoke-free housing. We've done some informational interviews with key stakeholders like tenant legal advocates, city leadership, public housing leaders, and rental licensing experts. Last summer and fall, we did a lot of outreach and engagement at numerous community events and found that about 90% of respondents said they did not believe smoking should be allowed in multi-unit housing. And then this year, we're doing some listening sessions with diverse communities throughout our city to do a little bit more in-depth work. And now I'd just like to speak a little bit to what we do in terms of tobacco policy and point-of-sale work. So the City of Minneapolis and City Council have long been leaders in this work. In 2005, the city ended indoor smoking in restaurants, bars, and other spaces. In 2015, the City Council voted to restrict sales of all flavored commercial tobacco products, excluding menthol, to tobacco-only shops and off-sale liquor stores. And then in 2017, that ordinance was amended to include menthol. And then in 2018, Minneapolis joined numerous other cities in implementing a policy not to purchase tobacco products for individuals unless they were at least 21, and that went into effect at the federal level in 2020 as well. Since that time, Minneapolis has not implemented any new policies around commercial tobacco products, although Councilmember Vitaw has several proposed ordinance amendments to our current tobacco ordinance on the table that will be going to council next week. So just wanted to speak briefly to those. So you'll see the 4 proposed changes that Councilmember Vitaw has proposed, and I'll speak to the public health rationale to each of those. So in terms of The first one, ending price discounts and coupons. So the tobacco industry uses price discounts and coupons to keep prices low, and through this, they're able to target youth and individuals living in low-income communities and communities of color. Low prices on these products are associated with increased initiation and use of the products and make it much more difficult to quit. And keeping tobacco prices high is one of the best ways to reduce initiation and promote cessation of these products. So in terms of increasing the minimum price, that is one way to reduce consumption, and especially true for young people who tend to be most price sensitive. So when studies have shown that for every 10% increase in the price of cigarettes, adult smoking decreases by 3 to 5%, and youth smoking decreases by 6 to 7%. As well, increased prices of commercial tobacco products is associated with an increased calls to things like quitline and other ways to end tobacco. In terms of increasing the penalty for tobacco licensees that violate city policy, this is, again, to just increase compliance with current city policy and protect the health of those living in Minneapolis. And the majority of our store owners do a good job in complying with these policies, and so they wouldn't notice any change. And then finally, ending the sampling loophole. So that would end any indoor sampling of tobacco products. Right now, the Minnesota Clean Indoor Air Act has what we're calling a loophole where they do, and I'm just going to read the language here. So the Minnesota Clean Indoor Air Act allows the lighting of tobacco or use of electronic delivery devices within the indoor area of a tobacco or vape shop, so that would be a tobacco-only establishment, by a customer or potential customer for the specific purpose of sampling the products. So closing this loophole would help protect the health of customers and employees in these establishments and reduce fire danger. And it would also bring us in line with numerous other nearby cities that have already ended this sampling loophole, such as Arden Hills, Brooklyn Center, Falcon Heights, Golden Valley, Mounds View, New Brighton, Roseville, Shoreview, and St. Paul. And just the last bit that I would like to share about work that we're doing. So in 2019, the state of Minnesota sued Juul Labs on behalf of the people of Minnesota for violating consumer protection labs. And in 2023, the state of Minnesota settled with Juul Labs. We actually received the largest per capita settlement in the country. And the Minnesota Department of Health is one of the ways that they're distributing these funds is to local public health to conduct store audits to determine compliance. So we will be using this funding to assess 191 of our 324 tobacco retail stores in Minneapolis between March and June of 2024. So we'll be looking at all non-chain gas, convenience, and grocery stores, as well as any exclusive tobacco retailers. We'll be assessing at least one of any chain store. However, we will not be conducting assessments within bars and restaurants or liquor stores. And we'll use this information to inform our future tobacco policy work, as well as to have really relevant and up-to-date local data that can be shared with community members and decision makers such as yourselves. And so that's just a quick summary of our past and present tobacco work at the Health Department, and I'd be happy to take any questions.
Thank you for that presentation, Evelyn, and to you and the Health Department for helping improve the lives of our residents. I'll pass it on to Council President Payne.
Thank you, Chair Chavez. I was just curious. I know the mayor has like a work group exploring the implications of cannabis legalization, and I'm wondering if the Health Department is participating in that and how you see this body of work aligning, because I know that there's differences in terms of the health impacts of smoking cannabis, but there's similarities as well, and I was just curious to what extent some of this work might influence our cannabis policies?
Absolutely. So I believe the health department is involved with that work. I myself am not because I'm grant funded, and my grant funding is specifically for tobacco work, although I see Heidi Ritchie is here and she could probably speak better to who at the health department. That said, we really see there is very close alignment with a lot of this work, and it is our hope as a health department that we will learn from our work around commercial tobacco, especially with work around education and point of sale, and some of the best practices that we've learned over the last 20 to 30 years and considering our cannabis work. And as well for our smoke-free housing work, we do consider, smoke is smoke, and secondhand smoke is real. So those two areas are of great alignment.
Thank you.
Thank you. So can you go to page number 8? I just have a few questions.
Absolutely.
And if it's, that's totally okay. I just want to understand a little bit more about the penalty in particular, and then the data that you said that most tobacco small businesses or folks that sell are in compliance. Can you just walk me through that a little bit more?
Sure. I actually presented to the Business Housing and Zoning yesterday, so let me see. So I don't believe that actually I have the slide that has the penalty matrix, past and present, although I could grab it for you. But basically the matrix, it would increase both the cost of the penalties as well as the suspension and then eventual revocation. And so we do have, it's a 4-tiered with the final tier of the matrix being revocation. I do know that in 2023, I believe the business licensing conducted about 200 store audits. We are, per state law, required to do audits at least of under 21 annually, and they found about 10% noncompliance.
Great, thank you. And I was up last night watching the committee hearing too, and I just want to clarify. So number 2, the increasing the minimum price, I think it's $15, correct?
That's correct.
Okay.
So it'll be $15 per pack of cigarettes, 4-pack of cigars, loose tobacco, 3 ounces, and chew as well.
Okay, thank you.
0.32.
I don't have any questions. I just want to make sure. And the folks in this committee, there was a committee hearing in the Business Housing and Zoning Committee. There was a public hearing there too. And this is coming to a vote at full council next week. So I just recommend that folks look at the committee meeting if they have more questions. So thank you.
Absolutely. Thank you. Appreciate your time.
I'll pass it on to Councilmember Palmisano.
Thank you, Mr. Chair. Just a couple of questions. I'm curious if in your role, something that came up in yesterday's committee and has been raised to me by small business owners, usually owners of gas stations and that sort of thing that do sell tobacco products, has there been any, an analysis that when we raise the price to $15 per pack or, unit, and we do say that small business owners then keep that extra proceeds to offset the amount, the reduction of purchase.
Correct.
But do we know how that will shake out? I don't think we believe that would make it even, correct? I say that with the concern shared of small business owners to me that it's making their business unviable. So I'm just curious if there's been any study on that, or if you know from other places that when we raise the cost of products from a regulatory perspective, does that make up for a reduction in purchasing?
Thank you for your question. It's a very good question. We haven't done any studies to look future outlook to see how that cost analysis would offset. We did see, even based on the article yesterday in the Star Tribune, that currently the average, a pack of cigarettes in downtown Minneapolis is $13.50. So this would be raising the cost about 10%, but I'm not sure about the potential reduction in sales associated with that, although the difference in cost, as you noted, would go back to the small business owner. We could look, if the council was interested, to see if there is any research from other cities that have raised their minimum price. I know that St. Paul has implemented minimum price not too long ago, or we could look to also, I do know anecdotally that when we We had similar arguments when menthol was restricted to tobacco-only stores, and I don't believe that there was significant loss in business from that, but that's just anecdotally. We'd have to go back and do research.
Yeah, I'm not sure that we would have that information
don't
either
know
to
that
be
we
able
would-
to
yeah.
research. The other piece I'm just curious about is in some of your earlier materials, you showed a campaign that wasn't telling people not to smoke, just not to smoke inside.
Mm-hmm.
And given the pretty significant changes we're looking to potentially make to this ordinance, I wonder, doesn't that seem a little weak? I don't mean to say shouldn't we just be telling people not to smoke? I think we're telling people not to smoke when we make these ordinance changes. And is there an opportunity to message that in ways that will reach people?
Thank you. I think there's significant opportunity to message that to people. And I will say whenever we do any presentations around smoke-free housing, we do a lot of work. We have gone to resident councils, for example, at Minneapolis Public Housing, or working with property owners and managers. We always bring information about smoking cessation resources. We are very fortunate in Minnesota to have a free very good free cessation resources through the Minnesota Quit Partner. And they even have resources specific to certain communities, for example, Native American, people with mental health issues, as well as pregnant people. And we always bring those materials with us and provide them. So I think there is significant opportunity, because anytime you implement a new policy where you're encouraging people to stop smoking, you want to also provide them with the resources to do that, because we know that it is very difficult to quit smoking. And actually, on average, it takes about 13 quit attempts. So I would hope that any changes would be paired with very strong health messages about, and providing people with those resources when they want them.
Thank you.
Thank you, Councilmember Palmisano. I don't see, Vice Chair Wansley.
Thank you, Chair Chavez. I just had a question. I don't recall what slide it was on, but it was also regarding the smoke-free housing slide. Just wanted to see if we did any recent analyses to see if that 71% of market rate housing that was not abiding, it seems like, by that type of policy, if there's been any changes in that, because I believe that was in 2016, and seeing, any changes since.
Yeah, so I do know that it's my understanding that at most new buildings, and there has been significant new construction, so I would guess that number, and I know across the state, the availability of smoke-free housing continues to increase, especially in smoke-free housing, in market rate housing. And I don't have the number here. I thought I might have it. When we did the Section 8 survey results, we did continue to see disparities in the proportion of subsidized housing. It typically does have lower, it's less likely to have a smoke-free policy than market rate housing. So I don't know if that difference, the 45% versus 70%, if that gap is, I would hope that it's closing, but there is still likely a statistically significant disparity between the two.
Thank you for that. And then also with the funding to do an audit of a little over 100 or so retail stores, I wanted to get a sense of if there would be additional. I'm just interested to know kind of where all the 300 plus stores stand, and really getting the sense of, I know, the amendments address some of the loopholes, but if there's additional loopholes that's being leveraged to circumvent this regulation, and it seems like a full audit of all the stores would be helpful, but it seems like funding was only available for, the 191. Is there additional funding that could help get to the remaining of that 324?
We don't have additional funding. There are potentially opportunities. I will say that the reason we're doing 121 of the 324 is that we are only sampling one of each of the chain stores. So that would be things like your Walgreens or like gas stations, chain gas stations. And the reason we're only sampling one of the chain stores is that they tend to have very similar and follow similar policies and procedures. So they tend to act more uniformly. So we're hoping that at least we'll get a better snapshot of all tobacco outlets in the city, even though we are not sampling all of them, because we will be sampling all independent stores and things like that. But that is something that we could explore. Sometimes opportunities do come along for additional audits.
Yeah, again, really interested in this piece and just seeing how, some businesses have adapted to this regulation. I know when there was allowance of, for instance, gas stations to sell, menthol cigarettes and things of that nature, when this regulation went into place, many of them just created tobacco shops in the back of their gas stations and was able to be like, oh, okay, business fixed. So, and while that, of course, this is legal, it does create a situation where it becomes a workaround, and possibly undermine some of the preventative work that we're doing and why we create these regulations. So really interesting to see what the findings of the audit will be from the 191, and if there are opportunities for council to support continuous auditing and evaluation of the full 324 minus you mentioned the corporate or the
Chain stores.
Chain stores, yeah. Yeah.
Yeah, thank you, Councilmember Wansley. You bring up a really great point of unintended consequences and the store splitting. And do want to acknowledge, I didn't put it in here as some of our past tobacco work, but in response to that, the City Council did put a moratorium on new tobacco licensing and then put in place a 2,000-foot spacing ordinance that we now have in place. So there has to be 2,000 feet between any tobacco-only store outside of the downtown business zone district. So that was one way. But once again, that's another example of how we can learn from our past commercial tobacco work is we consider cannabis and cannabis retail outlets as well.
Awesome. Thank you so much.
Thank you.
Great. Thank you for that presentation, Evelyn. We really appreciate it. I don't think there's anybody else on queue, so I will direct the clerk to receive and file that report. And seeing no further business before us, I will declare this meeting adjourned.